So good afternoon. Welcome to the next webinar in our Living Safely with Dementia in our community. Today's focus will be on interactions with fire services. Sorry, I was just clicking something there. So I'm Sarah Sweeney. I'm a public education coordinator with Alzheimer Southwest Partners out of the Elgin office. I'll be the moderator for today's webinar. And in the background, we've got Susan Oster, as I had mentioned already, and she's also an educator with Society out of the London Middlesex office. At the Alzheimer Society, our role is not only to provide programs and services for people who are going through the journey of dementia, but also to provide dementia education and to advocate for those living with cognitive disabilities. There we go. Sorry, I forgot to advance that slide. This is my first one, so everyone be very patient with me. But I've got a good teacher with Susan. So, okay, so just a few things before I start. A little business related to the webinar experience. So please note that your cameras are off, microphones are muted for the webinar. The event is being recorded, and the recording will be available in the future on the webinar archive page of our website. During the webinar, we'll have two scenarios presented, which will have their own discussion and question and answer period. If at the end of the presentation, you have some remaining questions, we will do our best to address as many questions as we can. During the presentation, if you think of any questions for the panelists, please add them to your Q&A box located at the bottom of your screen. If you see, I think it's right here on the screen. Kind of shows the Q&A right there. If you would like to submit a question anonymously, please click the Send Anonymously box before clicking the Send button. Should you have any technical concerns, please type in the chat box and Susan will be happy to help you. You may need to move the cursor around to see the Zoom controls and icons. You can submit your technical concerns in the chat box, and they will only be seen by the panelists, which includes myself and Susan. Another thing that we've enabled today is the upvote feature in Zoom, which allows people to see all questions being asked and to move the most popular questions to the top of the list. If you see a similar question posted by someone else, you can simply vote on the question by clicking the thumbs up icon underneath the question as seen here. Once the icon is clicked, the question will move up in the list. And a disclaimer, since everyone's situation is unique, the information being provided in this presentation is for educational purposes only. Should you have a specific question about your situation, please contact your healthcare provider or your support worker. So now I have the pleasure of welcoming our panelists. Abby Hall is a registered social worker for the Alzheimer Society Southwest Partners. She has a Bachelor of Social Work from the University of Waterloo, go Waterloo, with honors as well as dual degrees from the University of Waterloo in honors social development studies with specialization in social work and honors sexuality, family, and marriage studies. Abby has a passion for helping people in her community through her client-centered practice. And Kim Destin, Chief Fire Prevention Officer for the City of St. Thomas Fire Department. Kim has been with the St. Thomas Fire Department for 25 years. 20 of them were serving as a 911 dispatcher before she obtained the role of Fire Prevention Officer. In fire prevention, she is involved with fire investigations, fire code inspections, and public education. Kim has been involved with the Alzheimer Society for the past 4 years with her role in the fire department, and her father is currently living with Lewy body dementia. Thank you both again for joining us. Okay, so we'll now go into our first two scenarios, which include real life stories of those in our community. Their names have been changed, who are living with dementia, and some of the safety issues that have been found by their family, care partners, and emergency services. Both Abby and Kim will discuss the scenario, and then we'll have a question and answer period. So our first scenario, we're going to call her Ruth. She's an 80-year-old woman diagnosed with dementia. She lives alone in her own apartment. She has 2 children, a son who visits once or twice a year, and a daughter who visits once or twice a month. Neither of them live in the same city as she does. Ruth struggles with memory issues, self-awareness, and comprehension due to her dementia, and is a heavy smoker. Ruth can manage her daily tasks of living independently, but relies on her close neighbor, Laura, for support with groceries and housekeeping. Laura checks in on Ruth every other day or so to make sure she's okay and updates her daughter on any issues or concerns. So some of the concerns around fire safety for Ruth, some of the things that have been found in her house. So a burnt and singed dish towel, scorched pots and burnt food. The fire alarm goes off frequently. Burn marks from cigarettes on furniture and Ruth's clothing. Multiple candles burning unattended for undisclosed amounts of time. Huge piles of newspaper and magazines that take up space and block doorways. So we're going to go into our discussion now with Abby and Kim, just discussing some of the things about Ruth and ways that you as a care provider or friend can help Ruth make her home more safe. So who would like to, Abby, do you want to start with your view of what you see of Ruth, and then we'll go into Kim to talk about some specific things that she's seen as a fire inspector.
Absolutely. So welcome everyone. Like Sarah said, I'm a social worker here at the Alzheimer Society in London, and so I am very happy to be here today. So with this case, when it would come onto my desk, the first thing I would look at is the social supports around the person living with dementia. So social supports can be formal or informal, formal being your doctor, your social worker at the Alzheimer's Society, your care partner. It's any really a professional who can help you navigate your care partnering journey. So we also have informal social supports as well, which include family, friends, neighbors, coworkers even. And so in this instance, I would look at who are the key players in this situation and who can help. So we would identify the daughter, the son, the neighbor Laura, who helps with housekeeping and groceries. We might even identify other neighbors that could help as well. Maybe even a faith community or another health professional. A lot of times it's not what's being said, but who's saying it. So if your person isn't receptive to your concerns, sometimes having a doctor say the same thing can be helpful because of that that view that the doctor is a bit more expertise on the subject. Another thing we would look at this case is who are the community resources that we can call upon for supports and services. So home community care would be one of them who I would say would come in and do a safety assessment of the apartment and identify any safety concerns. Another community resource that could be helpful is the fire department to check fire alarms, as well as say Meal on Wheels to help with the meal prep portion of the concerns. A professional assessment, so a safety assessment by home community care would be very helpful in this situation because they would be able to identify areas where not only is there safety concerns around fire, but safety concerns overall. For making a care plan or safety plan for this client, there are a few things that the care partners can consider. In regards to cooking, the care partners can look at turning off the fuse or the breaker, going to the oven and stove if they're worried about having their person cook unattended. You can replace ovens with alternative appliances that have auto shut off. So crock pots, panini press, sandwich makers. There are a lot of other, there's a lot of alternative cooking appliances out there now that can replace a stove. And there's many different recipes out there. I know, for example, you can make different desserts now in crock pots. So it's utilizing um, the different tools that we have and bringing them into the situation and working with the client's strengths. What I would also suggest as well is you can get auto off knobs for the stove, which automatically turns off the stove. This is helpful if you're a person is easily distracted or have many memory issues. Writing a schedule. I'm not writing a schedule, but implementing baking or cooking activities into everyday routines can help because the person's not seeking out that activity. Um, in more extreme cases, cameras can be utilized as well to monitor the person, or you can use supervision. I think that a key component when looking at these scenarios is knowing that each case is very unique to the people involved. So so the general tips that we share today, adapt them to your situation, and if you need help with that, your social worker at the Alzheimer's Society can help with that. Um, Using meal services like Meals on Wheels can help with the cooking aspect as well. And finding a way to do the activity in a supervised manner out in the community can be helpful. So if the person's really keen on cooking, but we don't want them cooking alone, unsupervised, finding a cooking class that they can utilize out in the community can help as well. In terms of smoking, it's very important to acknowledge that it's a very complex issue because smoking has layers that come with it. There's the addictiveness of it, there's the codependency. With dementia as well, we know short-term and long-term memory is stored differently in the brain. So if the person's been smoking for years and years and years, that long-term habit's going to be already established and it can be hard to break. So my recommendation would be seek out your GP and talk with them about harm reduction approaches to helping your person either stop smoking or at least decrease their smoking. In terms of working with this situation, sometimes taking the amount of smokes out of the pack and putting in the allotted amount that the person is supposed to smoke can help because they're not looking at the access of the cigarettes. Again, it's a long-term habit, so it is not something that we need to be aware of. Another one would be as well is using fire retardant blankets, throws, even clothing in case of the person living alone where you're not able to monitor their smoking. Cameras can also be used as in this situation as well. In terms of the candles, suggestions could be replacing the flamed wick with a fake candle. If your person likes the candle because of the scent, it's using a fake candle with, say, air fresheners or room fresheners. So you get that experience without having to worry about blowing out the candle. And again, cameras can be utilized in this situation. Again, it's up to your situation and what you feel is appropriate for your person. In terms of hoarding, I would say connect with home community care. They can help with getting supports in place to help with that, as well as hiring maybe a cleaning service or having or organizing the clutter. So having bins available, having a place where these things can go instead of being scattered around the floor. In these situations, it's important to remember that we need to balance the person's dignity, respect, and autonomy, as well as safety concerns. And so in these situations, safety concerns always come before that autonomy, respect, and dignity, despite the fact that we do need to consider those in those situations.
There. Thank you so much, Abby. And definitely there's the social aspect around keeping someone safe. It's years and years of habit. This Ruth might have newspapers from the 40s that are very special to her and meaningful. So it's very difficult for both the smoking and the hoarding. Not just her love of cooking too. It's tough to break all these habits that we've been doing for years. So Kim, so as a from the fire department standpoint, I'm sure you've seen things like this, and again, doing the preventative part and not the reactive part that you sometimes might see.
Yes, absolutely. First of all, thank you for having me. What we often have to understand is how the fire department ends up at this person's house, or how we get notified that there is concerns in the house. So often it's not that big. We get the fire and then we go in there and then we refer to Alzheimer's. Often we get in and we're doing an inspection of the building completely unrelated. Maybe the fire crews are running medical calls. Sometimes the Alzheimer's Society has called us and said, hey, we've seen these things. Wherever you are in the province, you're more than welcome to reach out to your fire department. They have fire prevention officers. We will come into the building with obviously with the coordinated with the tenant or with whoever their friend and family are, and we can do that walkthrough. So often we'll have suggestions or we'll have responses to certain issues that you might not know or aware of, or like many that Abby listed already, like the smart burners on stoves and kind of stuff like that we're able to come through and go, okay, if you do this and this and this. We focus less because we don't have the resources for that social worker side, or that, we can't get you to stop smoking, we can't get you to stop hoarding, we can't get you to stop cooking, but we can often find ways to make it safer. We often are, from the Alzheimer's perspective and from the caregiver's perspective, we don't want to make them have to change, right? We don't want to make them have to give up cooking because they really, really like it. Sometimes that's just the reality of it, and that we're going to unplug the stove and we have to find workarounds to that. There's lots of things in the interim, many of which Abby, timers for when they're in the kitchen, and it really depends on that person's ability and where that person is at the time. But also keeping in mind that needs to be reassessed a lot because it changes constantly. And a person living with dementia, could go along really great for a month using a timer to remind them that the stove's on. And then all of a sudden that kind of falls off the charts and they're not doing that anymore because of the change of mental state. So that has to be reassessed by the family and the caregivers all the time, so that we're not getting into not having that safeguard we thought was in place. We've had other situations where the families unplugged the stove because there was issues with cooking with the person living with dementia, and they put a toaster oven on top and said, okay, you can use, or they put a toaster oven on top of the stove and said, you can use that rather than using the stove. What they didn't do is unplug the stove. So then the person turns on the stove, sets the toaster oven on top of the stove on fire, and subsequently we ended up at the house. So there's little things like that when we see it every day, that's kind of stuff we can help with. So nobody should be afraid to call the fire department and say, hey, I've got these issues. Please, give me any advice you can. Certainly, as Abby talked about, there's smart burners for stoves. You can use timers for how long things are on the stove. We talk about smoke alarms, and you'll hear me say it in every single webinar ever, regardless of who we're talking to. Make sure you're testing the smoke alarms. Make sure you're testing the smoke alarms and that you're working with the person living there. So when the daughter of this woman comes over once or twice a month, she should be pushing the smoke alarm and then re-vocalizing what to do with that smoke alarm. So this is the noise it's going to make, and I want you to go outside and go to, so-and-so's house, or whatever the plan is there. Discussions should be had with the person about in the middle of the night. Do you make sure your glasses and your walker and your whatever mobility aids you have are right next to your bed? So you put them in the same spot every night. That way they're easy to grab in case the smoke alarm does go off, and really practice that escape plan. And that's really important with both young children and people living with dementia, because they need that reinforcement that this is the sound of the smoke alarm and this is what I do. And if you do that every time you come over and say, this is the smoke alarm, now what do we do? then hopefully a little bit of that will be, you know, muscle memory. When they hear the alarm, they go out rather than panicking, because that's common with dementia patients, is it's a loud noise. I mean, in new builds now we have strobe lights and alarms that go off, and it's a lot. When everything goes off, it's a lot of noise and a lot of flashing lights. So they need to realize that that's what that is, and hopefully they can put that together and know what they need to do then. We talk about the smoke alarms with absolutely everyone. We would get into, like Abby said, getting into those contacts, getting into those people that are there to support. So if you've got a neighbor that's nearby, you know, if you hear the smoke alarm going off, please come over and bang on the door. This particular case study, they live in an apartment. So that may also involve getting the landlord involved. Every big building over a certain amount of apartments has a fire safety plan. And in that fire safety plan is, if you have someone in your apartment building that cannot self-evacuate, that's listed in the fire safety plan. So when firefighters show up at the door at 3 a.m, they're going to know that this woman in unit number 3, she can't may not self-evacuate. And then they take steps to go get her or have her shelter in place, but with clear communication rather than just assuming that everyone got out okay. So get the landlord involved, get the neighbors involved, and just have them be very aware. Make sure your smoke alarms are working so that when they go off, everybody goes, gee, I hope she's okay. And they go over there and bang on the door. And if it's a false alarm, that's fine. But they're taking action right away. We talked about the candle thing, right? And yes, she likes the smell of the candles, or she likes to have them. So replace them with battery. And that may not be an option. That may be one of those things that you listen, no more candles. We're putting in battery ones, and we'll do it to whatever we can to make it the same for you, but you're going to have to use the battery operated ones. The smoking, same thing that Abby said. We would look at stuff like making sure that she has big, deep ashtrays, and only a few of them, not having them all over the place. So typically, a lot of elderly people will have that one chair in the corner that's their nest, right? They always sit in and watch TV all day, and making sure there's a good solid ashtray there. And then things like wool blankets, flame retardant clothing, stuff like that, if you're seeing a lot of burns. Smoking fires typically are the most fatal fires, because the fire is starting very close to the person, and it's often in furniture or it's in clothing. So they smolder, and then you get more smoke, and most people succumb to the smoke before they get into a fire situation. So it's something that, you know, if you can get them to smoke outside, that's great. If it's years and years and years of habit, then it's going to be tougher to deal with. But it has to do with that particular person, right? And what they will work with you and what they won't. And then as you reassess to determine whether it's going to be a changing situation or not. Kind of touches on the piles of newspaper and the magazines. Hoarding is, I mean, it's a huge situation, and you'll often have people that just have big piles of stuff and aren't necessarily a true hoarder. When you get into a true hoarder, that's a next level thing, and that requires a complete team effort but if, you know, when the family's coming over and she's got stacked piles of magazines or newspapers or whatever it is, making sure those exit ways are clear, making sure there's a path throughout the house, so that if, you know, the person has a walker or has poor eyesight or something like that, as Alzheimer's, they get the tunnel vision, right? That's one of the things. So making sure that if they're in a hurry in the middle of the night to get out of the house, there isn't a pile of papers that they're going to trip over, because trips and falls during a fire situation are one of the big ones. And we have to be very cognizant of that when we're looking at someone's house that may be living with dementia as well. Removing combustibles, all of that kind of thing, just general tidiness. Abby spoke about a housekeeper. Sometimes that's helpful. They just kind of get overwhelmed, so they just keep putting piles of stuff. I mean, I do it at my house, so if I was overwhelmed, that's what I would be doing too. So just little things like that. But my main point being, call the fire department, and we will absolutely come and help. And we won't be there to give you trouble. We're not going to come in and say, I'm going to write you a ticket because there's no smoke alarms. We're going to come in with the eye to get it, you know, to make it safer for everyone involved.
That's great. Thank you, ladies. Just kind of reiterating on the importance of having a partnership, like for the Alzheimer Society and the St. Thomas Fire Department, for example, working together, and it's a long-standing relationship before either Abby or myself were working with the society. So it's wonderful to think of all these preventative things, and then looking at our own homes and looking at our parents. Both my parents are reaching 80, and you can kind of see some things that might be a risk, even though they don't have dementia. So it's a good opportunity for all of us to think about the safety. So we're going to get into the question and answer for question or scenario number 1. So just a reminder to put your question and answer or questions in the Q&A, not the chat. And I see there's already one in there, so that's wonderful. And you can also upvote. So if there's lots of question or the same question you want to ask that's already there, you can just click on the thumb. So I think the first question right now, how often are apartment buildings required to run fire drills for their tenants? And is that different for retirement homes, long-term care?
So apartment buildings are required annually. When you start getting into long-term care, then there's a whole lot of different regulations, and where they need annual inspections. They need to do a vulnerable occupancy fire drill that's supervised. Generally, on the whole, when you get into long-term care, it's a much higher level of standard that they have to obtain. If it's just a regular apartment building, then it has to be once a year that they are going to do that. But certainly, the fire department should be doing inspections on that. And we have to remember, if we're in our own home, then ultimately we're responsible. So if I live in my own home and I own it, and I'm a person living with dementia, that it's ultimately on me for this fire safety in my building. If I am renting from someone, it's all to the owner. So if your smoke alarm, if the daughter comes in and she sees that mom's smoke alarm, tests it and it's not working, always notify the owner, because they're the ones that are ultimately responsible to make sure that those smoke alarms are going, that the batteries, it's been tested, all of that stuff has been done. It's not typically up to the tenant. I mean, never disable a smoke alarm, but if it's something that they realize it's out of battery and all that kind of stuff, then yeah, it's up to the landlord to make sure that that's being done as well. And if you have concerns, so you were in, say, your mother's apartment building, you're like, I don't know, there's a lot of things here. Maybe the alarm system doesn't seem to be working, something like that. Absolutely reach out to the fire department again. We can do inspection on any building at any time. So we're more than happy to make sure that that building's up to what it needs to be.
Great, and that kind of piggybacks onto the next question. Do rural fire departments, which are majority of mostly all volunteer run, have the same capacity to come out and do the walkthroughs that you were talking about, Kim?
Yep, absolutely. So even the volunteer departments, and we have to keep in mind that Ontario is 70% volunteer departments. So the large majority of Ontario is run by volunteer departments. They do have to have a chief, they do have to have a fire safety program, and they have to do fire inspections. That's one of the few things that are legislated with the fire service. So there will be, and it oftentimes in the smaller departments, it's going to be the chief of the fire department. They will be the chief. They will also be the fire inspector, but they have all of the same programs that generally the bigger cities do, and they're more than willing to come out and help in any way they can.
That's great, Kim. Thank you very much for answering that. So we're going to get on to our next scenario. So we've got Jack and Darla. So those of you that lived through the 80s, as soon as I saw this, I thought of Jack and Diana. Abby, you're not old enough to know who Jack and Diana are. So Jack is a 78-year-old man who is a care partner for his wife, Darla, a 75-year-old woman diagnosed with dementia after experiencing a stroke. Darla was a dedicated housewife and mother to their 5 children, while Jack worked long hours outside of the home. Darla loves to cook, as that is how she expresses her love and identity. Jack has taken over majority of household duties, including cooking, but Darla was insistent that she continue to cook. And initially, Jack had no significant concerns about Darla's safety in the kitchen, but soon Jack noticed a decline in Darla's ability to safely navigate the kitchen. Just trying to forward the screen here, sorry. So concerns about fire safety. forgetting items on the stove, resulting in burnt food, misusing kitchen items such as placing plastic bowls in the oven, disregarding safety rules like using metal in the microwave, misreading recipes leading to improper cooking temperatures and duration, become distracted and leave the kitchen unattended for extended periods of time. One incident resulted in a small fire that Jack was able to extinguish before it got out of hand. So again, very similar to Ruth, but this is where someone is actually living with the person who's having all of these concerns. And Jack, again, is not a domestic being, so finding it very difficult to help Darla through this and also keep them both safe. So who would like to start off this conversation? Abby or Kim? Do you want to go first, Kim, since Abby took some of yours from the last time?
Sure. So this one really calls out for supervision, right? She loves to cook. She wants to, he is in the house. I would immediately want to talk to them about the smart burners that won't burn a pot. They only go up to a certain temperature. They'll let water boil, all of that stuff. But when it gets into a pot that's boiled down to nothing, it will shut the burner off. The shut off timers, like Abby discussed in the last scenario, timers on the stove, but having him there, is really the thing. And if it's a situation where he can unplug the stove when he's got to go out and he's leaving her by herself, unplug the stove in the microwave. And then, when we come home, I will be here for you when you cook supper. And she can absolutely cook supper. And then he's there to kind of monitor and make sure she's not going off into the other room and forgetting what she's doing. And that's just kind of overseeing it, right? That would allow her to continue cooking and doing that because, he probably doesn't want to. She's probably way better at it. So let her do it, but have that supervision there all the time. We go back into the smoke alarms again. I mean, they got, when they had a fire and he had to put it out. If there was no smoke alarms in there, or it's that timing, it's getting there fast. And if he's in another room of the house and the smoke alarm goes off, that gets him there faster to try to rectify any problem or call 911 and get out of the house, right? Depending on how big a deal it is. But like this specific one really talks about his education and getting him to kind of buy in with that supervision and how to work around allowing her to still cook, but having him there to kind of watch over and make sure things are getting done safely.
And Abby, is there anything you can add around your role as a social worker or supports out in the community that could help Jack and Darla?
Yeah, absolutely. So for this case, again, we want to look at the key players. Who are the people who are going to help with supporting both Jack and Darla? So they indicated that they have multiple children. So it's reaching out to the children and maybe having, every Saturday they bring the kids over and they bake cookies, right? Incorporating that activity into the routine can be helpful. Like Kim said, supervision is going to be key here. Jack is going to want to make sure he's observing his wife while cooking, making sure that, she's not putting metal into the microwave or putting a plastic bowl into the oven. The thing that we want to remember is we want to set guidelines and we want to make changes that align with our person's abilities and their capacities. So in this instance, it's not going to be beneficial for anyone for, Jack to turn around and go, you're not allowed in the kitchen, you're never able to cook again, right? Especially because her identity is very tied up with cooking. So one thing would be is she has to come to Jack before she starts cooking. And that way Jack can bring a buck into the kitchen while she cooks and makes dinner, right? It can also be finding that motivation for that behavior. So for instance, in this scenario, we identified that Darla very much expresses her love and it expresses her identity through cooking. So that's the motivation most likely that's going to drive her into wanting to continue to cook. So it's using that motivation and redirecting it. So it in this instance, she is very motherly and has a maternal instinct. So that might maybe having her join a program like an adult day program or the social, which is one of our therapeutic rec programs at the Alzheimer's Society, and have her be the person that brings out coffee or helps another peer. So it's working with that motivation and finding that motivation that might be driving the person. In an instance of doing a safety plan around this situation, and a Alzheimer disease or dementia-friendly clock can be very helpful. There are specific clocks made to help with being able to read better, be able to interpret the information from the clock better, as well as timers. Another thing is labeling. So we know with dementia that verbal cues become less effective as progression happens. So those visual cues are going to be very helpful in this instance. So it's labeling where everything goes. It's labeling the cupboards and drawers. It's labeling the cookware, maybe putting a little warning, a little stop sign on it to say no, doesn't go into the oven. It's simplifying the recipe. So if she has complex recipes that have her making homemade aspects from scratch, it's maybe buying those main ingredients pre-made, allowing for a more simplistic version of that recipe. Again, using auto off knobs or burners can be helpful. Using supervision again. Also using reminiscing can be helpful. So chatting about her experiences cooking. So, what's your favorite thing you've cooked before? Remember that pie you made for granddaughter's birthday or cake for the birthday, right? Reminiscing can be helpful in this instance too, because it's maybe a way of her wanting to build connection. And then also redirecting as well. So, wife wants to bake cookies. Jack doesn't have the time or the capacity maybe to go in and supervise her. So it's redirecting that attention going, well, we might not make cookies right now, but remember those chocolate chip cookies you made for that bake sale? Everyone loved them. What's your secret? Redirecting that attention. One thing we wanted to consider when working with people living with dementia is socialization and stimulation are very, very important. So again, cooking is one of the ways we express love and our connection. So it's maybe using that activity and doing it differently than what we would usually do. So instead of having her bake cookies for the neighbors who just moved in, it might be bringing over the recipe to them and saying, if you want me to teach you how to make them, I'm available. Also, Kim touched on education, especially for the care partners involved. We have education programs here at the Alzheimer's Society that could help. So first steps where we chat about how dementia affects people, how it affects the brain, and how to plan ahead would be something that could be utilized. Also, we do enhancing care programming, which is out of the Reitman Center in Toronto, where it's a little bit more comprehensive around your situation, and we kind of go more in depth on how to handle your specific situations in the context of your care partnering journey. So a program like that might be helpful for Jack, so he can bring forth his concerns around fire safety and say, in my situation, this is what I'm experiencing, and learn the tools and strategies he needs to protect wife as well. It's again, using socialization as a tool. So it might be going out in the community, doing a cooking class, or going to, if say they're involved with a faith community, maybe helping with the lunch after service. But it's again, adapting the changes that come and not doing everything at once or bubble wrapping, as I say, because we want to respect the person's autonomy. We want to respect the person's dignity. And we want to respect their personhood while also acknowledging that there are safety concerns that do need to be addressed.
That's great. Thank you, ladies. And just speaking from experience too, I love being in the kitchen preparing, but it's not just me in the kitchen alone. There's usually someone in there with me. So it's all tied together to um, making someone happy through what you're doing. So even for Darla to, for Jack to ask Darla, can you show me how to do this? Or am I stirring it right? Like getting more involved, which would be good for Jack too, to learn how to cook like Darla. So kind of on the note about cooking. So there was a question about the smart burners, and I know they're very popular in university and college dorms where they don't allow anything but these items. Could you elaborate a little bit more on that, Kim, please?
Absolutely. So the smart burners, you can buy them to fit into your stove. You can also buy stoves that already have them in. Typically, they keep the level, the heat level below what oil would ignite. Other ones that, and there's many makes and models. It depends on the stove that you have or what the burner you're buying. They have other ones that if the pot gets lifted off, it automatically shuts down. There's I want to say the conduction. I may have that word wrong, where you can touch the burner, where you can lift the top off and you can put your hand on the burner and it's not hot. It boils the water through electricity rather than the heat of the burner. So there's lots of different options. And again, it depends on your stove. And Abby spoke about it earlier, that there's also lots of different ways to cook things, whether that's crock pots and all that other stuff. Typically, Darla is cooking that recipe. She's cooked that way for 50 years and, the grandkids like it. And to try to tell her to do it in a crock pot now may not fly. So we have to work around that with the stove and looking at that. But so if you go to your makes and model, Google the make and model of the stove online. And then if they don't they don't have specific burners that go to the make and model, then you can do like Amazon and find ones that will work for your stove. But each model has something different, or they have different safety devices. So it's really is a matter of shopping around and kind of finding what's going to work for your stove and what's going to work for your situation.
Great, thank you, Kim. I forgot to mention before, if there's any other questions regarding Jack and Darla's situation, you can put them in the Q&A. Oh, then we had a thank you for answering that last question, so thank you. Susan just put something in the chat, a link to a provincial webpage about fire safety in your home. Oh, yeah, general fire safety at home. So thank you, Susan. I hope all of you can see that. If there's no more questions about Jack and Darla, I almost said Jack and Diane again. Any more thoughts on, we've touched on smoke alarms, touched on safety plans. How about electrical plugs, extensions? I know even when I
Oh, I think she's froze up.
Oh.
So to talk about while she seems to be frozen.
Thanks, Kim.
While she's frozen, talk about electrical plugs that she mentioned. You want to make sure you're not buying your extension cords from the dollar store. You're not going on Amazon and getting them from China. You're buying good extension cords to use. Extension cords should never be used as permanent wiring. So if you have not enough sockets in your house, or not enough plugs in your house, so you've got the space heater and it's hooked up to an extension cord, that's gonna wear that extension cord down, and it's really going to be a fire hazard. So if you're using extension cords and you're putting them down under carpets and stuff like that, and oh, that's gonna fix this, we're gonna put this down for a fix to not having enough plugs in the house, that really is a fire problem. Overloading circuits, also a big problem, right? Where you got 100 things in there. You buy the octopus thing from the dollar store and you plug in 15 plugs to it. That's a major problem as well. So, when you're looking at your own house, or when you're looking at the person you're caregiving for, have an eye about stuff, and then look around and really honestly look at it, go, is this a good idea? And we all know, right? We all know the things that we do that we're like, oh, that was probably not a real good idea, but I'm just going to do it for a few minutes. I'm just going to do it. I'm just plugging the Christmas tree in on the 40-foot extension cord for right now. Right. And then it sits for 2 months or whatever. And we know when we're doing things wrong. It's like being on a diet. We know we shouldn't eat that, but we're going to do it anyways. I know I shouldn't use, whatever to heat up my living room, but I'm going to do that anyways, because so it's looking at the houses and looking at the houses that we're caring for, with a kind of a good eye of fire safety in mind, and going, okay, I know that's a bad idea. Let's make that not happen. So that really, we could sit all day, and I'm sure Abby and I could go back and forth all day long with fire safety tips, and you should do this and you should do that. But it really is just that common sense, and having the people that are watching out for the person living with dementia coming in with that eye to say, okay, how can I make this safer, and keeping fire safety in mind. And fire safety, as Abby mentioned earlier, there's all, we have to respect the person and we have to respect all of the things, but there is at some point where you have to say, no, we cannot do this anymore. This is dangerous, because ultimately the safety of that person is paramount. Right. So that's kind of something that, and it makes it tough. I mean, it's same with driving, with people living there. There's at some point you got to make that cutoff. And, we had to do it with my dad. Enough. Yeah, I know you think you can do it, and I really don't want to take this away from you, but yeah, you're not doing that anymore. And often fire safety comes to the same thing with the cooking. There is a time where you have to go, no more. And that's really hard on everybody, and it's really unfortunate, but it is something. The other thing that we ask is, you use, and Abby kind of alluded to it earlier about, sometimes if it comes from someone different, if it comes from a doctor, if it comes from somebody different, they'll take it a little more seriously. Use your fire department for that. If somebody's doing something that is harmful or that's dangerous, if you have the fire department come in and say, listen, you just can't cook anymore, or, can we put the candles away? We can't do that anymore. Often that's taken, and we're okay being the bad guys. We're really good at it. So reach out to us and, can you come in and speak to my wife about whatever it is, and tell her that she just can't do that anymore or whatever. And most fire departments are more than happy to do it. Like I said, we're really good at being the bad guys sometimes. And it's easier for us to tell them and then for them to be mad at us, and then we walk away and go back to our office, than it is for the caregiver to tell them, and then they're mad at the caregiver for days and days and days after. And so having that in, and it also reinforces it for the caregiver that, yes, I am making the right decision. And even though this is going to suck, we have to do it.
That's great, Kim. I'm sorry I got cut off. I lost internet, but thank heavens for personal hotspots on iPhone. So sorry about that, everyone. I wasn't sure if this question was talked about. It says, talk about automatic recliners, their plugs, and what to watch out for. Any comments on that?
So the biggest thing with automatic recliners is that they go up and down. Often the cord will get trapped underneath the mechanism on the bottom, and it'll start to wear that cord. And that's where you get the fires, right? Because it's worn the cord. Often it's not near a plug. So, or they've got other stuff in the plug. So again, we're back to that extension cord, right? We're using an extension cord. We want to make sure that we never have the cord or the extension cord underneath the chair. Because what that does is every time you sit down in the chair, or every time that chair is actioned, it further wears down that cord. And that's where you get it, so it shorts and will spark and cause a fire. And remember, you have, electricity in a giant foam chair or cotton material, right? So we want to make sure that it's always open. So, and I spoke about it before. Often people will have their favorite chair in the corner. They have all their stuff around them. They got a coffee table. They got all their stuff, and it gets kind of like a little nest around their chair, especially if their mobility is low and they're not, they need help getting up and stuff like that. So then they tend to get all of their stuff really close by, and it can often crowd that chair. And then when you get into wearing wires or whatever like that, it's just more of a hazard, especially if there's smoking in them. Then you've got kind of all that stuff around. So keeping stuff kind of uncluttered around the chair is a good idea as well. Oh, did we lose Sarah again? I've lost everyone.
Muted.
All right.
There. Okay, sorry. So the next question was, you both of you could help out on this one, both from social worker perspective and working with the Alzheimer's Society, and also fire prevention, escape planning. So we all know about the everyday escape planning. We practice it at kids, as kids. We practice it with our own kids in school, things like that. But for someone with dementia, and we have talked about it a little bit, but something unique that you could use for someone with dementia, either living alone or living with a family member, something you could put in place to make sure they have a proper escape plan.
So I would say with safety planning, especially with emergency planning, so for, making a fire escape route, that sort of thing. One thing that we need to remember with when working with someone living with dementia is consistency and routine are key. The more you do it, the more ingrained it's going to go into that short-term memory, and it's going to move into long-term memory. So I know Kim had just chatted about it a little earlier that the more you practice, the more it's going to become second nature to do it. A little unique tricks that can help is making sure there's adequate lighting, especially at night. If something were to happen, motion censored lights are helpful for that, so that the person, especially when they're living alone, doesn't have to rush to try to turn on lights to see where they're going. Again, I chatted about this a little bit before. Verbal cues aren't going to be as effective as progression happens. Visual cues are going to be. So it's maybe having the emergency plan written out in bold, big letters that the person's able to comprehend, and having it near the exits. It's maybe having an arrow showing, the route that we need to take if there's a fire. There is now motion, so they're motion censored voice recorders. So basically what you do is you record your voice, and when there's motion, it speaks whatever you would like to say. So if a fire, if you can utilize that by having instructions about what to do if the fire alarm goes off. But the big thing is that consistency and that routine. You want to make it into your everyday routine. So as progression happens, that person's able to recall upon that routine better than, say, if they haven't practiced it and then all of a sudden they have to do a bunch of steps. Dementia affects a bunch of different skills and capabilities. And a lot of them, the ones that we recognize or that, come to mind are memory, comprehension and recognition. But there's also a bunch of different other skills and capabilities that are affected. So one of those is something called apraxia, which is the loss of purposeful movement. So the person loses their ability to plan, sequence, and execute steps. So we need to keep those in mind about how those symptoms of dementia are going to affect our person. Another symptom that might come into play is apathy. So it's the loss of a motivation or initiation. The best analogy for that is the starter button. The person has gas, the person wants to do that task or that activity. It's just they can't get themselves to start that. And so if there is an emergency, they might have issues with initiating that emergency plan. So it's making sure that we are aware of those symptoms that are affecting our person, how they're affecting our person, and implementing that into the emergency planning when we do that.
Great. Thank you, Abby. And Kim, anything more to add on that?
No, whatever, everything Abby said, absolutely. And so, and that, like I said, we preach it every time. Practice, practice, practice. We can go to school and schools will do fire drills very, very regularly. We can empty a school of 1,000 students with all varying levels of abilities and disabilities and everything else in under 5 minutes, just because they practice it so much. Be in there, and that's another way for you to have eyes on the person's abilities. And if there's a decrease in abilities, they could go along for months, and you press the smoke alarm and they evacuate and everything's good. And then you do it that one time and all of a sudden they're confused and they're not sure. And that's that red flag that, okay, we got to start changing our plan because it's, things have changed or whatever has gone on. The alarms, they do have fire alarms now that you can program. So that what they found was that in children, they'll sleep through the beep, beep, beep. But they will respond to a voice recording of their mother's voice saying, get up and get out of the house. So that's available, right? So if the smoke alarm goes off, instead of just having that beep, 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 you can record your voice, yeah, Mom, get out of the house, and then give her kind of some quick directions. Or so there's lots of different things that are available. We can get into bed shakers, all of that kind of stuff that would help depending on the situation, and really is depending on the situation. Big signs on the doors, go out here, all of that kind of stuff that Abby talked about, and having those big visual cues. So at 4 in the morning, when the smoke alarm goes off and it says, Mom, get out of the house, they know how to get out of the house. But really practicing all the time, so it becomes that memory, and that also, so you can also have a good idea of where they're at now, rather than, well, they did it last year, so it was okay. Make sure we're keep practicing, and you'll work the kinks out too. Often we'll go to a building in any general sense, and they'll be like, yeah, we test the fire alarm all the time. Okay, but have you done an actual empty the building out? Well, no. Okay, let's do that. And then afterwards they go, oh, we had this problem and this problem and this problem. It's not till you physically do it that all of a sudden these things come up, like, oh, Mom couldn't find her glasses, or Dad couldn't get his walker, or then you can work around to solve those problems as they come up. If you kind of just think through it, okay, I'm going to hit the smoke alarm and we're going to pretend we're doing it, often it doesn't kind of bring up the real life situations that come up. So absolutely practicing that fire escape plan it's massive. It's really a big deal, both with people living with dementia and everybody else.
No, that's a great point. I'm just thinking of my mom's front door. They don't use the front door, they use the back for their main entrance. And they've got one of those snake, those funny wiener dog looking things that sit to stop the draft from coming in. It's very heavy, and that would prevent the door from being opened easily. So just anything like that too. It's nice to practice and good to think of. So I don't see any other questions in the Q&A box. So I think we'll move on to the end. So Kim and Abby, it's been wonderful getting to know you. We've done some meetings and some practice sessions over the last few months, and it's been great talking with both of you. And hopefully we can work together again soon on a variety of things. We know the discussion today will stimulate further conversation for everyone on the webinar today. We appreciate your knowledge, your expertise, as we all work together to keep those living in our community safe. So again, thanks to our attendees. I can't see any of you. I know a few of you on, so it's nice to see you. Thanks for attending this month's Living Safely with Dementia webinar. I've got a little slide here. There's, if you go onto the Alzheimer Canada website and just type in making your environment safe, there's a few things there. There's even a home safety checklist, which is pretty important, and it's just kind of a nice way to start to make sure your home is safe. So lastly, I'm trying to click this. There we go. You can sign up for our e-newsletter, and I think Susan's put some other things in here, ensuring safety, security, all kinds of things. So you can click on that before we finish and save it into your own, for your own information. So, and you can also sign up for the newsletter, which is a great way to keep abreast of what's happening with our society, which encompasses London, Middlesex, Oxford, and Elgin. And then when you leave the webinar today, just click the little red leave button. And then right after you're done, there'll be a survey that'll pop up. So if you could fill that out just to make sure that we met your needs today. And if there's any other suggestions for further education sessions too, that would be wonderful. So thank you again, all of you, for coming. And it's 1 o'clock, so I won't keep you any longer. So thanks very much, everyone.